Kathy, most people link chest pain to a heart attack, but chest pain is not always a warning sign in people with heart disease.
And joining us to talk about hidden signs of heart disease is Dr. Jonathan Fialkow, the Chief Population Health Officer at Baptist Health South Florida, also the Deputy Medical Director and Chief of Cardiology at the Miami Cardiac and Vascular Institute.
Oh, you said it. What a mouthful.
Said it, and there's one more.
Thanks, guys. Actually, one of the other titles, which is near and dear to my heart, pun intended, is that we've developed what we're calling the Mcvi Lipid Management Program, which is specifically for patients with genetic or complex lipid disorders. I'm a medical director of that as well.
Well, congratulations to you.
Thanks. They're all kind of related.
Well, don't take away. I mean, that's good. Okay. So, but nearly half of all adults in the U.S. have some type of heart disease, according to the American Heart Association. That's over 120 million people. That's a really big number. So why is it so common, and why are we seeing a continuous growth?
So it's actually kind of interesting on two components. The first is why is it growing? The second is why it's common. The way I look at it and the way I express to my patients, if you think about this, is our civilized lifestyle, where we drive from place to place. We go to sleep late at night. We're looking at bright screens all day. And we're eating foods that we didn't go out in the farm and pick and eat ourselves, is not what our bodies were evolved to exist under. These are circumstances that are different, and as a result, the body gets inflamed, it reacts to these lifestyles, and it leads to vascular disease. The arteries get inflamed. So I kind of look at our civilization as a civilized lifestyle that promotes heart disease and vascular disease. So we want to recognize who has vascular disease, who has risk for heart attack, premature death, and want to intervene in that population of people in ways that are obviously safe and have benefit. So it's prevalent because of our lifestyle. It's growing, if you think about this, because heart disease is the most common cause of death in the world, and certainly in Western civilization. And we've done great things to decrease deaths from heart attacks. That doesn't necessarily mean people don't get heart disease. They're not dying from it because they can be taken care of quickly in a hospital if they're having a heart attack. We have devices. But in about 2012, those death rates plateaued and started going up again. And one argument why is we've got a lot of weapons to prevent heart attacks and keep people alive, but nothing new has developed, but we're less healthy. We're older, more obese, more inflamed. So if we're a higher risk population and we don't have really new tools to lower that risk, we're going to start seeing increases.
But doctor, you said a higher risk population in the United States. Is it the same globally?
It tends to translate to urbanization. So if you look at third world countries or developing countries where people live out in the farms and people doing a lot of manual labor and eating naturally, they don't get high rates of heart disease. They might die early of something else, or they just don't get it. When people start moving into cities and following that urban lifestyle, even if you go to the gym an hour a day, which is fantastic,
right,
you're not out doing physical labor 7-8 hours a day like indigenous populations and people in those environments. So it follows urbanization. China, for example, has one of the highest rates of new diabetics and heart disease, because part of the Chinese experiment, if you will, is to move their people into the cities for higher paying jobs.
I was going to ask you, what does cardiovascular disease consist of? You're talking about there's signs of diabetes as well. What does it consist of?
So cardiovascular disease as a whole is anything that involves your blood vessels and your heart. The main drivers of cardiovascular disease deaths would be heart attacks and strokes. Strokes are considered cerebrovascular, cerebral brain, but it's still the same vascular abnormality. So when we're talking about cardiovascular deaths, we're talking about deaths from heart attack or stroke, or surviving a heart attack or stroke, which is also something we want to avoid. Those are the main abnormalities. We're seeing something called congestive heart failure, which is one of the more common reasons people get admitted to hospital. So when the heart muscle weakens, that's a consequence of surviving a heart attack. You live, but you've had damage, and now you're living with the consequences of that. So that's another increasing cause of cardiovascular
That's permanent
disease.
damage to the heart?
Most often when people have weakening of the heart muscle, it's permanent. It can be from different reasons, but it's permanent.
Dr. Fialkow, even if you're on medication for heart disease, it doesn't necessarily mean you're cured of heart disease, because it can't be a free-for-all for those who are on medication to say, well, I'm on medication now, so let me just go do what I want because these medications will protect me.
So that's a great point. It's actually quite humbling in the cardiology world, and I can argue in other medical spaces, that we don't know everything and we can't predict how an individual will behave. So for example, if I have 10,000 people who smoke, I can tell you if we follow them for 20 years, I'm going to see more heart attacks and cardiac deaths in 10,000 smokers than 10,000 non-smokers. But not every smoker has a heart attack, and not everyone has a heart attack as a smoker. So we have to look at the whole environment of the patient. It's not just this blood test, just this thing, it's our whole lifestyle. So we try to identify who has these components that put them at risk,
right,
and then we want to lower the risk. We don't eliminate the risk. even when we use the medications, which are incredibly powerful, like statins and blood pressure pills, I can't go to a patient at risk and say, I'm going to put you on the medication. I guarantee you're going to be dancing in my grave at the age of 120. We're lowering the risk, but that person could still have a problem. So we don't want people to be fooled to say, I'm taking my pills, I can do whatever I want, I don't have to worry about things. We don't want people to worry, but I don't have to be concerned. No, it's you want to improve all the aspects of your lifestyle, which may provide cardiac risk.
We know some of the obvious signs of heart disease. What are the hidden symptoms? Like
So
fatigue, for example?
Sure. We tend to think of chest discomfort or chest pain as the main cause or the main sign of a heart attack or heart symptoms. And it's a pretty big one. It still is pretty reproducible. Most people with chest pain are not having heart attacks. That's the art is how when someone's feeling something, we work to say, don't worry about it. You don't have to rush to an emergency room versus don't be a fool, get to your emergency room, and we got a ways to go in that space. Most people visiting emergency rooms with chest pain, concerned it could be cardiac, are not having heart problems.
So that whole image that we see in the movies sometimes where people are holding their heart because they're feeling a chest pain.
So that is the classic description of angina, which is the discomfort one feels. We usually use what's called Levine sign. When people clutch their chest like this, they're subconsciously telling us there's a squeezing sensation in the chest. So the classic symptom, if you exercise, you get a muscle cramp because the muscle's not getting enough blood for its activity. It's the same thing. It's a cramping sensation. But most people don't get that classic sensation. So it could be other kinds of chest discomfort. Then there are, as you're alluding to, the non-chest discomfort signs. Jaw pain. Sometimes people feel like an achy pain. They go to the dentist or they think it's a tooth problem. But in fact, it could be angina. Indigestion, they start burping, they feel a little upset. And then there are softer ones, being a little short of breath when you're exerting yourself a little more, heart racing, and even fatigue, which is kind of concerning, but also an opportunity.
Never knew about the jaw.
Now, people can get a bad night's sleep and be tired.
Right.
People can have stress and not, getting a full sleep. So not everyone tired should be saying, I'm having a heart attack. But generally, if it's something new, if it's something you didn't experience before, and now you're just feeling really worn down, especially if it's worse when you're exerting yourself a little bit, it would be something to get checked out. Do you have to go to the emergency room? Should you call your doctor? That's a little bit different decision. But yes, there are people who present, women quite frequently, and they've just been really tired lately, and they're getting checked out for something, and we find that it could be a cardiac condition.
How about the old standard, the left arm is numb? That's a sign?
It's a left arm cramp, so that's important as well. The reason is the nerve that goes to the heart from the brain also says a branch to your jaw and to your arm. So sometimes the brain gets confused where the problem's coming from. So the classic description is like someone squeezing my arm. It's a cramping sensation. It's usually, again, worse when you're exerting yourself. So if you're sitting at rest and you're going like this, if you can touch it and make it worse, it's not your heart. But generally, that left arm discomfort in a situation where your heart might not be getting enough blood can be another anginal equivalent, we call them. They're not the distinct chest pain, but they're an equivalent in terms of their risk.
Before we wrap, Doctor, is it true that, as Derek was asking about the hidden signs, I thought about women, and as you said, sometimes women, it takes a little bit for them to process that the symptoms are heart attack symptoms. Is this true?
The symptoms are similar. There is some thought that women may get more of what we call the atypical symptoms, the fatigue, the indigestion, and maybe that's why they don't recognize as much. That may be true, but what really happens in women, especially as if I could use the term, caretakers of the family, they tend to either not recognize in themselves that I can have heart attack, when heart attack is the most common cause of women in the United States, or they don't want to deal with what they're feeling because they got to take care of the kids, they got to make sure the house is being run, so they wait longer than men. And quite frankly, I can tell you from experience, and I'm telling you, quite often the wife makes the husband get checked out,
right?
And they don't take care of themselves, so they're not recognizing they're at risk as well.
But do men have heart disease more than women? I know that women.
So men before the age of a woman's menopause have higher rates of heart disease. Women catch up later in life, especially after menopause. So heart disease is a killer of women. Younger women who smoke, it's even a more accelerated risk. But when we're evaluating someone, because part of the art of when someone is coming to a doctor or in the emergency room saying, I'm feeling this, is, well, is it heart-related or not? And when we look at what's the chance of being heart-related, I tend to ignore whether it's a man or woman. I even say if it's a man, would I consider it the same way? Then I'm going to consider it. And there may be a bias in our country against the thought that women can have heart attacks as well.
So we both men and women need to add that to our to-do list.
And the risk factors are relatively the same. I mean, your lifestyle risk is whether you're a man or woman and you're not getting enough sleep or you're not active enough or you're eating a lot of processed foods or all those things that are environmentally contributing to our risk. Women experience it just as much as men.
Thank you, Dr. Fialkow. Thank you so much for being on Smart Life.
Pleasure.